So, how do the eyes age? What sort of eye conditions, eye diseases come more commonly as we get older? And more importantly, what can we do to slow down these changes and hopefully even prevent vision loss from occurring? Today, we're going to be talking about just that. If you're new here to the live stream educations, my name is Dr. Joseph Allen, and I am the host here on the Dr. Eye Health channel. I am a board certified doctor of optometry, a fellow of the American Academy of Optometry, and a diplomate of the American Board of Optometry. I'm also a member of the Ocular Wellness and Nutrition Society. And I started this YouTube channel about 5.5 years ago to help bring public education about the eyes, vision, and help people see not just their best today, but hopefully help them see their best even into the future. So if you're here to the channel, welcome. This education, we provide live education. This is being recorded live right now. And so, hey, and thank you to everybody who's showing up. Please leave us a comment of where you're watching from. And if you have anything going on with your eyes, or if you have maybe family history of a condition that you maybe are worried about could be something that you're at risk for. With all of that being said, I do want to say a huge thank you to our channel members who help pick out what topics we talk about every month. And also, they get priority to ask questions, because at the end of this lecture, we will also be doing some live Q&A for anyone who has additional questions about the topic this evening. Thank you again for tuning in live for everybody. Also, again, thank you for everybody else who's watching maybe on the replay, as these live streams are also recorded and made available afterward. Otherwise, let's kind of dive in and begin talking about the eyes and how they age, because this is something that I know during my residency, most doctors during the residency see a lot of disease, and it's usually with older individuals. And so this is something I think a lot of doctors, we just kind of take for granted because we're so used to seeing aging changes on the eye. We start to just think they're normal. And I think it's a good thing to take a step back and look at, hey, what's going on in the eye and other things that we can do and be proactive about to slow down these processes. So, one of the first things, and again, we're focusing more on the aging changes of the eye. One of the first things that people become symptomatic about as they get older is a condition called presbyopia. And if you've never heard that term, that's okay. It's just the medical term or Latin term for the gradual loss of your ability to focus on near objects up close. And for anybody who's age 40 or above, you probably will start to recognize these symptoms. This is where you try to look down at your phone or you try to read a book, and it's just a little bit more difficult. In fact, probably the first symptoms I hear from patients in the clinic is that when they look down and then look in the distance, it seems to take a little bit longer for them to adjust between those two kind of focal points. But what happens is that it gradually gets harder and harder to see up close, and then people have to start reaching for either like reading glasses, magnifiers, or some other sort of magnifying device, such as the dreaded B word in eye care called bifocals. So let's take a step back and talk about like why this is occurring. Presbyopia is the loss of the ability to change the shape of the lens inside of the eye. And I love this picture. This is kind of showing an analogy between the eyeball and a camera, because a camera has I said the wrong word. It has more film inside the camera, right? That film or sensor is kind of like the retina in the back of our eye. And the retina is kind of like the satellite dish that takes the visual information and sends it to your brain so you can see. But the camera also has a lens, and the lens helps focus the light to the back of the eye. But in a camera, the lens can move. You can change the focus distance inside the lens and or inside the camera, and it'll move the lens forward and backward. In the human eye, unfortunately, we can't move the lens that we're born with. We can't move it back and forth like a camera. But human, like the evolution, the nature of the eye has grown in such an amazing way. Mother Nature found a way to allow us a muscle to change the shape of the lens inside the eye, and that changes the focus. The challenge is that this lens grows as you get older. It actually grows every year of life. It's kind of like if you dissect it. This is an image from one of some textbooks and some publications that you'll see. You can see individual rings on the lens as you get older. It's kind of like the rings on a tree. And so as that lens gets larger, it becomes more rigid and hard to flex. On top of that, that lens sits inside of a bag. It's kind of a membrane bag, and that membrane is pretty good, rigid, holds its shape when we're young. But again, as we get older, a lot of things become a little bit more lax. It loses its rigidity. And with that, it has a harder time pushing and remolding the shape of that lens. And so that falls into, if you're going to be really nerdy like me, the Helmholtz-Hess-Gallstrand theory of accommodation and the kind of the what happens with the development of presbyopia. So that's kind of why that occurs. And unfortunately, there's nothing we can really do necessarily to stop it, because just you live long enough, everybody, this process will start to occur. And so it's not as much of the muscle inside the eye having a negative effect to it. It's more of just the inability to flex this lens inside the eye. So we do have correction options, and this is what your eye doctors will always mention to you. You have options for multifocal glasses. That includes what are called either bifocals. You'll have progressives, or if you're in Europe or in other countries, sometimes they call them varifocals. But those are where you don't have the line for the bifocal. It's all blended together. And then you have multifocal contact lenses. Also, presbyopia eye drops, which just became available here in the United States about a year, almost 2 years ago. And a few more drops that are going to be coming out within the next maybe year or so. Those cause your pupils to constrict and become really small, and that improves your depth of focus. So I think that might have a great option for people to kind of get away from having to carry reading glasses with them all the time. You might just be able to put an eye drop in the morning, and it'll make your pupils nice and small, and you'll be able to see up close and be able to see your phone and function. So that could change the industry coming in the next year or two. Otherwise, surgical options. And surgical options usually involve some form of cataract surgery and implant of lenses inside the eye that give you some ability to still focus up close as well as see well in the distance. And we covered a whole lecture on cataract surgery implants about a month or two ago. And so we'll make that available in the description below if you want to learn a little bit more about cataract surgery. But a lot of you guys are thinking, okay, that's true, but what can you do to slow it down? Is there anything in the literature? And so I dug into a little bit. One big question that comes up are eye exercises. And anecdotally, I've heard from other practitioners who specialize in the world of vision therapy or vision rehabilitation. And there is some truth that people who do more focusing up close, a lot more kind of eye exercises to focus up near and look in the distance, it has the ability to almost keep the flexibility of the lens, a little bit more ability to focus more for maybe a few more months to years. But ultimately, still presbyopia does set in. And so it may delay things, but unfortunately, it won't be a cure or really prevent it in any form. So I don't really have too much research on that, but at least anecdotally from other professionals I've talked to, that's what everyone's telling me. Then there are supplements, and this is kind of newer research, and there's not too much out there, but I was able to find some publications on some supplements that might help. Specifically, looking into something called astaxanthin. Astaxanthin is a carotenoid. There's about 600 different a little over 600 different carotenoids found in nature. These are largely colorful pigments you find in fruits and vegetables. The astaxanthin, I started hearing about this because I saw it in some eye vitamin supplements, and I was like, what's astaxanthin? So I started looking into it myself. In 2014, there was a publication on the dietary supplement it contained not just astaxanthin, it contained a couple different things like lutein, which we'll talk more about in today's episode or in this lecture, and a couple other things. But they look specifically on accommodative ability. And this is your ability to focus up close. But they did this study on individuals over the age of 40. And they were looking specifically on people's ability to not only focus up close, but reduce any sort of eye fatigue associated with trying to read up close. And they did find that it helped with relaxation, or this is their theory, that because it did help a lot of people in these studies after a month of taking the supplement. And they found that it helped with relaxation and prevention of fatigue of the ciliary muscle contraction. And so it may not have a direct effect on the lens capsule or the lens itself, which is the ultimate cause, but it at least helped with the muscle contraction. So If people are also having any sort of kind of eye strain, eye fatigue issues with long reading up close after the age of 40, something of astaxanthin, you may notice more eye vision supplements containing astaxanthin, and that would be why. I think astaxanthin is still kind of a newer subject in the world of eye care that's being researched, so you may hear more about this going on in the future. Let's switch over and talk about cataracts. This is another topic we've talked about in other videos. If you're new to the channel, we have a lot of videos available. But cataracts is a significant thing that affects us as we get older. And I think it's worthwhile to talk about it a little bit more, especially if you're new to hearing about what cataracts are. So inside of the eye, the same lens that starts having this aging change, causing this near vision difficulty, as you continue to age past the age of 50, the lens can slowly start to become cloudy. And this clouding of the lens is what we call a cataract. In fact, the fun historical name of cataract is also a term used for waterfall, because when doctors would look at a cataract inside the eye, it would kind of look like white and frothy, because that's kind of what it looks like. And it looks kind of like the water froth you see in a cataract, a waterfall. Uh, but this clouding of the lens that kind of becomes yellow and white for some individuals, and even if it sits there long enough, it eventually can turn kind of a coffee brown color. But this becomes kind of like a fogged lens and causes a lot of glare. And so light kind of diffracts and becomes kind of scatters all over the place inside of the eye. And that's why you see in that photo there that kind of light isn't focused straight onto the back of the eye anymore. It's scattering. And that's why people have a hard time seeing. In fact, this is kind of a visual representation here of how somebody with normal vision driving, but somebody with a cataract will notice not only is vision more fuzzy, but colors are losing their saturation. So everything's kind of a little bit more bland colored. And then typically things are darker too. And that also has to do with because your pupil size usually gets smaller as you get older. So again, if you're somebody with more of a significant cataract, that's why it's difficult to pass a driver's exam when you are kind of going into the DMV to renew your driver's license, is because cataracts can affect your vision. So a good question you may ask, okay, well, why do we get cataracts as we get older? Because again, after the age of 50, they slowly progress. And some people always ask like, hey, are my cataracts bad enough? Well, everybody has cataracts at a different rate. Some people get cataracts early on. I've even seen some people get cataracts in their 30s. Some people get cataracts in their 60s. And then some people, I've even had a patient over 100 years old, still have cataracts in the eye, but they could still see about 20/25, and therefore they did not require cataract surgery. So pretty fascinating. But largely cataracts form due to oxidative stress. And this is a huge role in anything that causes us to get older. And it basically oxidative stress occurring within the cells causes damage to our ability to repair proteins. And therefore the cellular mechanisms within the cells start to break down and they can't kind of refresh or renew. And that causes a lot of aging changes. There are some other risk factors associated with cataract formation. Most notably that we see a lot is diabetes. People who are diabetic, higher amounts of sugar in the body end up leading to more fluid retention inside of the lens, and more fluid comes to oxygen, and oxygen also starts to speed up this aging process. Retinal surgery, vitreous degeneration or the development of eye floaters. And unfortunately, that comes more with age too. But as the gel inside the eye starts to change, the gel holds a lot of vitamin C. There's a lot of vitamin C inside the eye. And vitamin C works to sequester and basically prevent oxygen from getting to the inner tissues of the eye. And so when the gel inside the eye starts to separate, you lose vitamin C presence touching the lens. And so you end up higher amounts of oxygen end up building up on the lens, and you develop cataracts faster. Smoking and alcohol also associated higher risk for cataract development. If you've ever taken oral steroids or topical steroids, that also increases the risk of cataracts, and radiation too. Sunlight. This is a good question. Let's talk about the sunlight for one moment, because you'll always hear doctors say, hey, wear sunglasses because that'll slow down the rate of cataracts. This is not wrong. It's true that sunlight does play a role in some cataract formation, but specifically a type of cataract called cortical cataracts, which usually we don't see until people are past the age of 40 anyway. In addition to that, most sunlight does or UV light from sunlight does not penetrate through the cornea. So, only about 10% of cataract formation is theorized to come from sunlight exposure. However, as we'll talk about, that doesn't mean that you shouldn't need to wear sunglasses. It's really important to continue wearing sunglasses. We'll talk about that more in a little bit. But I just wanted to be clear that people understand that yes, sunglasses can slow down the rate of cataract formation, but it doesn't play a huge significant role. Instead, those other factors that we just talked about, especially smoking and alcohol, those play a big role. And then potentially dietary factors, which we'll mention here in a moment. We did talk about cataract surgery as basically the ultimate treatment for cataracts. And again, we did a video on this. And so we'll again link that in the description below and maybe in the comment section if we can. So prevention, how do we prevent, how do we slow down the rate of cataract formation? So there's many studies that have gone over this in many different parts of the world, looking at people here who are either in the United States or Europe. There's different parts in India and Asia. They've all been trying to figure out, hey, do maybe supplements, do vitamins, does nutrition play a role? Do other lifestyle factors play a role? In general, people who spend more time out in sunlight or have sunlight exposure do tend to have a higher risk for cataracts. People who are malnourished in unfortunate, like developing countries who are malnourished, starving countries, they have higher risk of cataracts. So they do know nutrition plays some role in it. As far as taking a multivitamin, I want to be I wish there was like a solid answer. Yes, people who take this multivitamin have a 30% reduced chance of having cataracts. Unfortunately, there's just no solid data to prove that. There are studies that show, hey, taking vitamin C, vitamin E has slowed down cataract development for some studies, but then other studies come out and do the same thing and they don't find the same result. So it's very mixed results in terms of taking vitamins to slow down cataract development. With that being said, there is a lot of practitioners that I know still feel like it may not be a bad idea if somebody's at high risk. However, again, it's still the studies are mixed. The major ones that are in studies, again, because vitamin C is known to play such a big role inside the eye, so it usually contains vitamin E and vitamin C. Those are usually the two big ones in research studies. Same thing with beta carotene, which is a carotenoid that your body converts to vitamin A. That's another one because it also plays an antioxidant role within the eye. Otherwise, there is some research on lutein, which again is a carotenoid, a pigment that you find in nature that works as a strong antioxidant and a anti-inflammatory in different parts of the body. Lutein is one of as I believe, the only carotenoid found within the lens of the eye. And this is of 600 plus carotenoids in nature. This is the only one that really goes to the eyeball and helps with many different conditions, but it is found in the lens of the eye. There are studies showing lutein supplementation has not just supplementation, but lutein diets containing higher amounts of lutein also have reduced risk of cataract formation. There's one study I found here that did show a 23% less prevalence of nuclear cataracts, which are one of the main causes of age-related cataracts, in people who had higher amounts of lutein in their diet. However, again, there's always some sort of however note in a lot of these. They did note that the people who are taking who had higher amounts of lutein are also individuals with diets that have lots of fruits and vegetables in them, because that's where lutein largely comes from in our diet. And so it's hard for them to say, was it truly just lutein that was slowing down the rate of cataracts, or was it some other factor related to eating these other fruits and vegetables? So with that being said, we largely, the healthcare or the eye care community, will still just focus on saying, hey, make sure to eat a heart healthy diet with lots of fruits and vegetables. So nothing new there. Every doctor usually tells you that same sort of thing, right? But I just kind of like to give you guys that sort of information and being transparent about, hey, this is where research is on vitamins. Here's where the research is on carotenoids. But lutein may have a great benefit for many things with the eye, but it may have a benefit for cataract prevention as well. But hopefully, as always, more research will give us some more information. This one I brought up because uh, this is kind of, could you not only prevent cataracts, but could you reverse it? Because this is a question I've had for a long time on this channel, and I've kind of, in a way, dodged around it. Uh, but just this last week, I posted a video about myths about eye care. And this is one that a lot of people have brought up. So I just wanted to be a little bit more specific about it. There are studies called, or this eye drop called NAC eye drops. This is a drop that is supposed to work as an antioxidant that affects the eye and supposedly could reverse cataracts. The reason why this is not an approved treatment and why doctors and people are very skeptical about it still is that there's very few studies on it. Most of the studies published on it are also by one doctor or one researcher who also happens to own a company who sells the product. And the methodology, even a Cochrane review in 2017, looked at two studies, one done in the United States and one done in Russia, and tried to collect the methods of how they did these studies. And the studies, basically, the methods had insufficient information of how they even did the study. And there just wasn't convincing evidence that it really worked. And so that's a challenge for us as healthcare providers who are trying to give solid, good recommendations to our patients based on evidence. Does this work or not? Well, if the methods can't be reproduced and and there's conflict of interest, right? So if a doctor just came out and said, hey, this is the magic pill that could cure your disease, and I've done these studies that no one else can seem to reproduce, like there's some level of skepticism that we have to have. So maybe in the future, more studies will be done on NAC eye drops and we'll know more if they really work. And maybe it could change healthcare. But right now, we just don't have enough evidence. So I can't recommend for people to use these sort of eye drops. And so that's why a lot of people are skeptical about them. Let me know if you've ever used these drops, know anybody who's tried these drops, and if you've noticed any sort of benefit, if anything at all. I think it's interesting, but I don't recommend people go and try them at this time until we have more evidence. So let's move on to the next thing that changes with the eyes. And this is one I think people don't talk about too much, but it's a very real thing. This is called dermatochalasis. That's, again, the medical term for how our skin and our face changes as we age. And this is the loose, redundant eyelid skin. So the skin that's affecting your upper eyelids, but also your lower eyelids. And this occurs due to changes in orbital fat, the laxity of your skin, and this results in blepharoptosis, sometimes just referred to as ptosis. And that's where the upper eyelid starts to come down and can affect your vision. And you can see it in this photo, there's kind of this hooding off to the side that comes down. And so the challenge is that as this occurs, your top part of your visual field can be obstructed by that hood of skin. So, you're looking straight ahead, but you can't maybe see the ceiling anymore because that skin's coming down. And some people will just be able to, while you're looking straight ahead, pull up their upper eyelid and you can suddenly see a lot more. So that might be an indication that this ptosis, or this skin laxity, is affecting your vision. And in the clinic, at least here in the United States where I practice, most insurances, health insurances, if we can show that, yes, vision improves when we tape the upper eyelid up and we do a special automated field test, then that might be enough for the insurance to cover the procedure called a blepharoplasty, which is where you see a oculoplastic surgeon, a surgeon who just specializes in treating the eyelids and the tissue around the eye. Also, plastic surgeons who specialize in the face will do this as well. But this is where they tighten the eyelids and they lift up that hooding so you can see better. They can also do it on the lower eyelids, but because the lower eyelids don't cause a visual like problem, the lower eyelids for under eye bags or swollen eyelids, that is considered more of a cosmetic procedure. And so that's usually not covered by insurance. But the upper eyelid drooping and getting in the way of your vision can be a certainly can be an obstruction of your vision. So, how can you prevent this skin laxity? Because this is a big thing. I think for a lot of us, we're used to seeing ourselves in the mirror, you seeing kind of a youthful appearance, and then as you get older, you can see the skin starting to change. Is there anything we can do to help prevent that? So first is skin moisturizers. This maybe doesn't have the strongest of evidence, but a lot of even dermatologists still agree that having skin moisturizers is important to keep the collagen of the skin working, to protect the skin. Things like having sunscreen on your skin, because UV light plays a big role in that. Uh, and so sunglasses also is a major benefit. And so I always tell people it's not just we're trying to slow down cataracts and other in things and going on inside the eye with sunglasses. We're in fact trying to slow and prevent changes to the surface of the eye and the skin around the eyes, because your eyelids are the thinnest skin on your body, and sunlight damage unfortunately can age that part of the skin. And so moisturizing cream, I've been using CeraVe for the last few months and honestly love it. So huge shout out to my girlfriend for recommending me to try that one. And then another possible thing, this is still kind of a newer research, but well, technically it's been out for a long time, but a lot more modern research is kind of getting excited about red light photobiomodulation. This is where red light, certain wavelengths of red light can activate the mitochondria cells, which are the energy powerhouse within the cell, and kind of wake them up to start working better. So a lot more research. I've been diving deep into that myself, and so we'll do future video and content around red light therapy specifically for the eye and the eyelids in future videos. So stay tuned. Let's then talk about macular degeneration, age-related macular degeneration, sometimes known as AMD or ARMD. So this is a significant thing, and honestly, if I was going to say one eye condition I am personally afraid of getting as I get older would be this condition. I've seen a lot of patients with macular degeneration, and I can see how devastating it can be to their not just their vision but their life. And I've seen it happen to people as early in their early 50s, like they haven't even retired yet, and they're going blind from this condition. Thankfully, most people don't get macular degeneration in their early 50s. Most people don't start having signs of it till they're in their 75 or higher, but it can be pretty significant. And so this is a big one I use as a motivation for me to eat healthy, to always take risk factors into consideration. We'll talk about that. Macular degeneration does cause significant central vision loss. So glaucoma, you maybe heard about, which also is higher risk as we get older. Glaucoma affects more of our peripheral vision, everything out to the side. But central vision, if you lose that, it's hard to read. It's hard to see your friends' faces. It's hard to see your grandkids. It's really hard to function if you lose your central part of your vision, because then you're trying to look off to the sides, and your side vision, you don't see quite as sharp. And the other part of macular degeneration that's scary is it's very slow for a lot of people. Slow enough you don't notice your vision changing. And by the time your vision does change, it's often too late. So that's why I strongly encourage people still get eye exams every year. That's what's recommended by the American Optometric Association. And especially if you're over the age of 40, still definitely do not be skipping years in getting your eye care. Make sure you're getting your eye exam every single year. The AMD in a nutshell, just to not go too deep in the pathophysiology of it because it gets pretty extensive, but in a nutshell, I like to describe it as a slowing down of the retinal metabolism mixed with inflammation, and that results in cell death of the retinal cells in the back of the eye. That's kind of my simple explanation of what's going on. There are two different forms. There's dry macular degeneration and wet macular degeneration. And I just had a patient yesterday ask me what's the difference between the two. Dry macular degeneration is thankfully more common and usually less severe until its very end stage. But even with the end stage of dry macular degeneration, it can have devastating vision loss. The reason we call dry versus wet is that the wet form, which is more aggressive, what happens is new blood vessels get inside the eye and start to leak fluid. And so we call it wet because there's fluid now inside the eye. So basically, when the retinal cells, our metabolism's not working well and there's inflammation, it's sending signals to the body. Said, hey, I'm not getting enough nutrients. I'm starving here. And that sends a signal where other parts of your body, that's good because new blood vessels will grow that way toward those signals. And that'll help repair and bring nutrition to that area that needs it. Unfortunately, inside the eye, new blood vessels can cause destruction. They destroy the architecture of the retina, which is very delicate. And then if they start leaking fluid, it can cause swelling and scar formation. And so that's why wet macular degeneration is best treated as early as possible if it ever starts to occur. The treatments for macular degeneration, and this is pretty big because these studies that started figuring out, hey, we can treat macular degeneration this way, kind of changed the way we think about how vitamins and nutrients affect the eye. These big studies were called the ARED studies. They've done at least two of them, and I know they're still ongoing. The most recent one that was completed, I believe, was 2014, and they found the AREDS 2 supplement. And so what they have out of this, and this is for people with at least intermediate stage macular degeneration. So if you have early stage, technically by the definition of the studies, not indicated, but if you have at least intermediate stage dry macular degeneration in one eye, then the AREDS 2 vitamin is indicated. And it's required for me to prescribe it to my patients once they have that level of that disease. And in that vitamin, they have vitamin C, 500 milligrams. They have 400 international units of vitamin E, 80 milligrams of zinc. This is the original formula, I should say. The original formula had 80 milligrams of zinc. It has some copper in it because zinc slows down your copper absorption, so they give you copper back. And then they also have lutein, 10 milligrams, and 2 milligrams of zeaxanthin. But there's no beta carotene. And I put that in there because the original formula of AREDS 1 had beta carotene in it, but they later in studies found people who supplement with beta carotene, if you had a history of smoking, increases your risk of lung cancer. So they got rid of the beta carotene. And a lot of, unfortunately, smoking is a big high risk factor for development of macular degeneration. So zinc, I just highlighted in yellow because I wanted to mention there are more modern studies showing some concern about zinc being too high of level, that some people may have faster development of macular degeneration because of too much zinc, but largely zinc is good for the eye. So there is still some debate about, is zinc needed in the formula? Is there a certain level of, is 80 milligrams of zinc too much? And so with more recent publications, you may have doctors recommending some vitamins for macular degeneration without zinc, and you may have some doctors recommending at least less zinc, closer to 25 milligrams or less. I just want to mention that. We don't have time to dive into all those debates that doctors have, but it's something that we'll report more on as more publications come out. Other treatments for macular degeneration, just so you're aware of it, there are anti-VEGF as well as complement factor inhibitors. Complement factor inhibitors are newer and they're more for dry, advanced end-stage macular degeneration. But then anti-VEGF, these are all injections of medications inside of the eye. And I know that's really scary to get an injection, like having a needle come toward your eye. Thankfully, you look away so you don't see the needle and they numb your eyes. You don't really feel it. But it is potentially completely vision life-saving. So it's really important. If doctor is saying they recommend you to get these injections, I listen to them because it's sad when patients are like, I don't notice a difference. And it's like, no, they're making a difference. You just need to keep getting them. It's not something we love to do, but these medications can change people's lives. So again, just listen to your doctors when they recommend that that's the next step. So prevention. So the agreed upon preventions are smoking cessation. That's huge, and I know it's tough if you're a smoker and you um, have ever tried to quit. It is the hardest thing to quit, most addictive thing on the planet that we know of. I just want to be an advocate for you, and all your doctors do. So if you ever tried to quit smoking and you're having difficulties with it, talk to your doctors. We can get you medications, patches, gum, therapy, whatever we can do to then support you to quit smoking, because that is a major risk factor for development of macular degeneration. Weight loss, people who have a smaller BMI are less likely to develop macular degeneration. And then people who are treating their high blood pressure. High blood pressure is a risk also for macular degeneration. And then there is some kind of, again, mixed research findings. A lot of doctors debate the early use of eye vitamins, like the AREDS vitamins for macular degeneration. Because if you have an early sign of macular degeneration, the research isn't quite as clear about the benefits of slowing it down or preventing the disease from taking those vitamins. And so some doctors don't recommend them, and they're very textbook. They're like, once you hit intermediate stage, then you take it. Otherwise, don't bother. Where other doctors I know are like, no, like, why wouldn't you recommend at the earliest sign of this disease? If you see the tip of the iceberg, why would you not do anything you can to slow it down? And so I know a lot of doctors, including myself, we kind of feel that way. It's like, why can't we recommend that? And then omega-3. Omega-3 is kind of an area of debate because, again, there's research done on omega-3 about its benefits for so many parts of the eye, including the retina, in conditions like macular degeneration, and it's very mixed. But I want to talk about that because the one that's most historical that doctors know is that in epidemiological studies, they find that fish consumption, people who eat more fish, are less likely to develop macular degeneration. And so this was a meta-analysis even from 2016 that reported that fish consumption has less risk for macular degeneration. And this is usually oily fish, things like salmon, mackerel, tuna, not as much, but there is some evidence in tuna in these research studies. However, then you turn and you look at taking omega-3 supplements as an alternative, and the research doesn't show much support. So people who eat fish seem to have reduced risk, but people who take omega-3 supplements don't. And so there's been a lot of confusion and tough for people to really recommend specifically omega-3 supplements to slow down macular degeneration. However, this is very recent. This is just starting coming out in 2023. They've largely looked at omega-3 because of DHA content. The photoreceptor cells in the back of your eye that are affected by macular degeneration are about 60% DHA omega-3. But the current forms of omega-3 supplements are in the form of what's called a triacylglycerol DHA. The problem is that these types of DHA don't cross the blood-brain barrier very well. And the blood-brain barrier, being that the retina and the eyeball is an extension of your brain, are very similar. And so now they're finding that, oh, maybe these omega-3s that people are taking don't even get really into the eye. And that would maybe explain why we don't see those benefits with the kind of the classic current forms of omega-3 supplements, where people who eat fish are still getting some of those of this other form of DHA called lysophospholipid DHA, which they have recently been able to start synthesizing in the laboratory and give to mice, and they find that it does cross the blood-brain barrier and can they're doing more research into it, into finding it can affect eye health. So this is really exciting. We still have a lot of research to go, but I know when I dig into it, I get really fascinated. So that may explain why, again, we focus so heavily on recommending a heart healthy diet, which is, if you're not sure what that means, it's still strongly recommending a Mediterranean diet, focusing on whole foods, on eating lots of fruits and vegetables, good amounts of fiber, and at least the classic historical definition of the Mediterranean diet includes things like oily fish, along with nuts and seeds. So those are all some great things to start changing in your life. other things that affect aging that we didn't cover today because we're just, we can't be here for like 3 hours. This lecture would be way too long. But I have covered other topics related to aging eye conditions, things like eye floaters. We've covered other videos on dry eye extensively. Also, diabetic eye disease affects the aging eye pretty significantly. So we've done some videos on those. And again, we'll put links in the video description below, as well as try to leave them in the comment section once we're finished with the education. So for more. With all of that today, I do want to say a huge, again, thank you to everybody who joined us, and a huge thank you to our channel members who support our channel. So thank you to all of you. We are going to switch into some Q&A. Please, if you have questions, I know I've been seeing people dropping things in the chat. Thank you so much. Go ahead and ask some questions. Try to put a bunch of, like, 3 or 4 question marks in the front of your question, followed by the question with some more question marks. So it'll stand out a little bit easier for me so I can answer them here on the live. I do like to give just a medical advice disclaimer. I'm not giving medical advice in these Q&As. I'm just providing education. I think that your eyes are precious and you deserve the best medical care that you can get. And the best medical care you can get is with a doctor in your local area. It's not just for me to cover my butt, but I just think, again, you really deserve the best. And so with that, if you do have a question, I will try my best to answer it in a just educational way so everybody can learn, and try to encourage some way for you to better understand what's going on with your eye and what you can do. So thank you again so much for joining us. And yeah, we'll get to going. I know the first question I heard earlier today comes from Kat, and that was about renewing driver's license when you have cataracts. So again, cataracts is a little bit challenging because, some people maybe don't need cataract surgery right away, but their vision's reduced. And it can be even more complicated if you only have one eye. Because some people, either for some reason, they only have one functioning eye, and then they have cataracts, and your surgeon's not going to want to do cataract surgery until it's absolutely necessary. And for those conditions, it's tough because every state, at least here in the United States, every state has a different law about your driving recommendations or driving laws. And so the best thing to do is talk to your doctor, make sure you have an updated prescription. And if for some reason you fail a vision test at the DMV, you can go to your doctor and you'll have a form that your doctor can fill out, because we have the specialized proper testing for eyesight and vision, be able to test your side vision and everything, where a lot of times the instrument that they have at the DMV is not super accurate. And so it's not really realistic. So yeah, definitely I wouldn't worry about it, but I would definitely talk to your doctor, bring in the form even ahead of time if you'd like, and have that all filled out. And then you'll be set to pass the driver's test for the DMV. So thank you, Kate, for that earlier. I'm going to pull up Barb. Thank you so much, Barb. Barb here says, will cataract surgery be problematic with floaters and dry eyes? So very good question. So as far as floaters, if you already have floaters, cataract surgery is not going to make a significant difference to it. Some people do notice more floaters after cataract surgery, and that can be because the inflammation and the surgical procedure kind of causes more degradation of the gel inside the eye. So it's not uncommon for people to see more floaters afterward. Dry eye is a concern. A lot of the industry is focusing on how dry eye gets worse after cataract surgery for a lot of people. And so we're trying to be more proactive about identifying severe dry eye before cataract surgery and getting it under control. That includes making sure the eyelids are clean, making sure that inflammation is turned down, whether that be with medication or whether that's just using more frequent use of just artificial tear eye drops, keeping the eye lubricated. And so I think it is a good idea to treat dry eye and get that under control before having the surgery, because then you can have not only better, more accurate kind of assessments before the surgery for the calculation of the implant inside the eye, but then also hopefully less complications of dry eye getting aggravated from all of the eye drops after the surgery, because there's a lot of antibiotics and steroid eye drops that all have preservatives, and that can irritate the ocular surface. So good question. And hopefully that helps out with that. Ooh. I'm gonna pull this one up, and I'm gonna be quick, but we're gonna leave this for another video because there's a lot to go into it. From James, why do glasses cost hundreds or even thousands of dollars for what are just plastic and wires and screws? I agree. It's kind of frustrating how expensive some glasses can be. I think there are a lot of economic forces at play. At least in my experience, a big issue with it is uh, so right now, at least in the United States where I practice, a lot of the cost of glasses is that high because it's offsetting how cheap the eye exam is. Most insurance companies don't reimburse the doctors or the facility very much at all. And so a lot of clinics, in order to even make enough money to keep the lights on, they have to multiply the cost of the glasses because they have to pay for the frame, they have to pay for the lenses, and then the insurance usually owns both of those two things, and they designate the price of all the the deductions and everything on that. And so for the clinic to even break even, they have to multiply the cost of those glasses by 2 to 5%, like two to five times the price. And so it ends up, um, you end up paying a lot more for the glasses for the piece of plastic, and you end up paying very little for the doctor's time. Where I think if it was kind of the opposite, if glasses were really the price of just the plastic of what it is, then you'd probably be paying $500-600 to see the doctor, and you'd be paying like $50 for the piece of plastic. So it would kind of switch a little bit. But it's a lot of it's a complex topic. And I don't know if I have all of the data to give a true answer for why that is. But maybe we can go deeper into it into a future video. Um, Teresa, thanks for being here. I've had similar issues with my eyes as you have. What are your thoughts on seeing sparkles mostly when in bright sunlight? That's an interesting one. Um, so there is so specifically in bright sunlight is an interesting part of it. Myself, the first thing that comes to mind is something called blue light entoptic phenomenon, and I have done a video on that. It's something that a lot of people do see. I know I see it, but this is when light, usually in shorter wavelengths of light, like in blue and purple light, uh, but it actually it gets magnified. It's believed to be it's hitting the blood vessels inside the eye, and then the white blood cells that are floating through your arteries, that kind of works like a magnifying lens in a way, and it shines light in different spots inside the eye where your eye is very used to the color red from the regular red blood cells that are floating through the blood vessels. And so now you're suddenly having this white spot amongst what your brain is used to seeing red, and then you see these white spots showing up, and it's usually occurs in your more side vision. Um, of course, I can't say for certain what's going on with your eyes without an exam, but I think that's when you're seeing sparkles off to the side in bright sunlight, that's might be an explanation for some people. The other thing that a lot of people ask, I just had a patient yesterday ask me, like, why is it that when I stand up, I see sparkles, like I see stars in my eyes when I stand up so fast? And that has to do with blood flow. It's called orthostatic hypotension, meaning you have low blood pressure, and then you stand up and you don't have enough blood rushing to your brain and the parts of the eye to keep seeing for a moment, and then your blood regulates itself again, and then you don't see those stars anymore. But those are kind of two potential things going on with those sparkles. Um, Good question from Alexi. Do you recommend multivitamins for dry eye? So I think for most people, if you're eating a good diet, you maybe don't have to take a multivitamin specifically for dry eye. However, there is some good information and research coming out about the benefits of some supplements for dry eyes. Things that are included in that include things like lutein, potentially getting more vitamin A. Uh, Vitamin C is in that. There is even a vitamin drink that came out in the last year. I think more research is still kind of needed to solidify how well these sort of formulations are on dry eye. But certainly omega-3s as a supplement, I've had good success myself, despite, again, the debate in both optometry and ophthalmology about if omega 3s really have that significant effect at reducing inflammation and helping with dry eye. There's again a lot of mixed research out there, but I personally have had good success with it. But so I hope to have more uh, good videos on solid data about multivitamins for dry eye. But thank you for that question. William thinks, is there treatment for crystals forming in the gel of the eyeballs? There are different types of crystals that can form in the gel of the vitreous. Most people who are born with like a calcium soap inside the eye, we call it asteroid hylosis. There's really no natural treatment for it. Most people don't need treatment for that condition unless it's really severe, and then they can have surgical intervention. Otherwise, for the gel inside the eye, we've covered in some other videos, there is some laser treatments to remove large floaters, and then there is a vitrectomy, where it's a surgical procedure to remove the gel inside the eye. There are some publications, and even I've used it for some patients, of prescribing low-dose atropine to make the pupil a little bit larger. It doesn't get rid of the floaters, but it doesn't truly get rid of the floaters. It doesn't dissolve them or anything, but it can maybe reduce symptoms for some patients, just because it makes them less noticeable. So very, very good. The good question from Patty. Thank you. How do you know visually when to have cataract surgery? Even at a younger age, again, I've had people who've had age-related cataracts as early as in their late 30s or early 40s. It's kind of atypical. Again, most of the time, people are more in their mid 60s, getting into the 70s when they need cataract surgery. You shouldn't really have to worry about it unless your doctor starts saying it might be something to think about. But if you, for some reason, symptomatically feel like you can't see to drive, you don't feel safe driving, you don't feel like you can function your daily, what we call your your quality of life measurements are reduced. So like you feel like you like to watch TV, you can't read what's on the TV, you try to read your phone, you have struggle to read. And again, you don't feel safe to drive. Those are sort of quality of life measurements. If they're affected by that, let your doctor know. And if your vision and cataracts line up with what they agree is causing those symptoms, then you may be a good candidate. So thanks for asking that. Let's see. Lynetta says, I have corneal dystrophy and cataracts. What type of lens and surgery with astigmatism? So it's tough when you have corneal dystrophies, because there's different types of corneal dystrophies. One of the most common one is called Fuchs corneal dystrophy. Fuchs is where the cornea and the front surface of the eye starts to become cloudy because there's a degeneration of a certain type of cells in the back of the eye, or in the back of the cornea. And a lot of time doctors have to be cautious about cataract surgery, because cataract surgery can aggravate that type of dystrophy and make things a little bit worse. So sometimes it's better to have it done earlier than later. But if it is a more severe form of corneal dystrophy, then surgeons can do a combined procedures at the same time to treat both cataracts and the corneal dystrophy. As far as the lens and the surgery, again, it's something that you really need to talk to your surgeon about, because they can do the proper measurements and make the proper recommendation. It's just, there's too much going on with the eye, and without that data in front of me, there's no way for me to make a recommendation for anybody. But I just say, yeah, definitely talk to your surgeons about that, about both the corneal dystrophy, the cataracts, and if there's surgeries to treat both, or if they just recommend one. So thank you. Let's see. This is another good question. This brings on a lot more modern, some more interest in the eye care profession is pretty interested in myopia. Myopia is the medical term for nearsightedness. We have this question about, it's a Aishal, asks, if a 20-year-old has -6 myopia or -6 nearsightedness and astigmatism, is there a big chance they will go blind later? It's tough for me to say like what a percentage would be for their chance of somebody like losing eyesight. I can't say somebody will go blind, but they do have, with increased levels of myopia above a -6, you do have a drastic increase in risk factors. And I'll tell you, I'm about a -6 too. Uh, I just wear contacts most of the time and then glasses to help with it too. But the when you are in a -6 level of nearsightedness, I know you have over, it's almost like 100. I don't have the statistics off the top of my head, but it's like over 180 times more likely to develop a retinal detachment in your lifetime because the eyeball elongates even by a few millimeters. And with that elongation, the retina stretches, and there's more likely to not just have vitreous and floater changes, but also retinal detachment. And we plan to do more deep dive videos with specific resources and statistics about all of these risks. The biggest thing, of course, for developing a retinal detachment is being aware of the symptoms, which are flashes of light, new onset floaters, and any sort of vision loss. If anybody has any sort of symptoms like that, definitely contact a doctor right away. Don't put it off being like, oh, it'll get better on its own next week. No, no, contact a doctor, get it checked out. The other conditions that are increased risk with high myopia include cataracts. Then again, that could be because the vitreous degeneration changes that increase with higher amounts of nearsightedness. Same thing with glaucoma, higher amounts risk for glaucoma with higher bouts of myopia as well. And so I always hope, that myself included, I won't develop any of these conditions. So that's, the big important thing of always seeing an eye doctor and having regular eye exams. There's also another risk for just myopic maculopathy, which looks very similar to age-related macular degeneration. So those are always conditions that we have to watch out for as well. I think if you're over a -6 or if you have high myopia, it's not a life sentence. Like, you're not guaranteed to get any vision loss conditions, but you are at higher risk. So I think it's important to be not only proactive about eating healthy, taking care of your body, getting regular eye exams, but if you also happen to have a like a child who's at risk of getting strong nearsightedness like yourself, we thankfully have ways to intervene now with our modern technology. We have specialized contact lenses and even eye drops that can slow the onset of myopia. And so instead of being in a -6, maybe you could keep your kid at a -2, and they won't have as big of a risk factor as they get older. So a lot of the industry is focusing on that. There are some eyeglasses in parts of the world that have some evidence to slow down myopia too, but at least in the United States, they have not been FDA approved. So I really can't speak upon that too yet. We're like waiting to see if the FDA will approve them, and then the industry might shift a bit. So very good questions. Uh, Barbara Sanchez, thank you so much for what causes eye floaters. Does it happen frequently after LASIK surgery? What can I do about it? And are there consequences of floaters? So floaters largely does occur due to age, mainly due to collagen breakdown inside of the gel of the eye. There is some higher risk factors for people who've had any sort of trauma to the eye or surgery in the eye. Inflammation is believed to accelerate the rate of the floater formation. It doesn't frequently happen right after LASIK surgery, but a lot of people are nearsighted, and again, nearsighted is higher risk for floaters. The LASIK procedure does put a lot of pressure on the eye, mainly due to suction when they're trying to use what's called the femtosecond laser, creates the flap for the procedure, and that increased amount of pressure may increase kind of a jostling effect, or may cause an effect on the floater development, but I haven't really seen too much publications directly linking those two. As a consequence of floaters, there's not much people can do other than, usually give it at least 6 months. Your brain starts to get used to it. There are some supplements that came out a year or two ago that we did even a video talking about, called the macula health, vitreous health vitamins. Although I think the industry at large is still kind of suspicious. I can't say suspicious, but we're just cautious because there's only a few studies on it, and there's some conflict of interest in some of those studies. So I think it's something I talk with my patients about. If they want to take it, just let me know so we can measure it in the clinic. We can try to evaluate the retina and the gel inside the eye and track it and see if there really is any benefit. So I think that's something to talk with your doctor about. But otherwise, the surgical procedures for the floaters again include laser vitreolysis and vitrectomy. I know floaters is a big topic. A lot of people love floaters. Um, and then I think this might be the last question that we take for this evening because we've been going for about an hour now. From Alexandria, can you take AREDS to preventative, like having high myopia -10? People can take AREDS 2 as a preventative measure, although again, evidence still is kind of lacking that it's not proven to prevent the onset of things like macular degeneration. However, I know a lot of doctors still feel supportive in saying that, hey, if somebody's at risk of it, it's probably not going to hurt anything other than maybe your pocketbook that you're spending some extra money to take these. I know the individual ingredients, like lutein, for example, does have good support in the research as being beneficial for all ages, not just for the eye, but for the brain as well. And so lutein is a big one that I personally take and I recommend for people. But it's something always talk to your doctor about, hear what they say, what they think. So those are just some good thoughts about that. Usually with lutein, somewhere between, there isn't a solidified recommendation for the amount of lutein yet, but most studies do support somewhere between 10 to 20 milligrams of lutein a day finds the most benefit for like the pigment in the back of the eye, as well as some other forms of visual protection. So thank you so much for that question. Thank you everybody for showing up live here and asking your questions. And just thank you for all of your support for the channel. Stay tuned for our next live stream next month. Otherwise, we'll put, again, additional resources for other topics around the eye in the description below and in the comment section. Thank you guys all so much. Have a great evening, and we'll see you in the next video.